Today's topic is kind of near and dear to my personal heart because, it is something that is going to touch and affect every person that is listening. Because either yourself or somebody that you care about or somebody that you love is going to be affected by it. And in fact, what we're talking about today is understanding heart attacks. See, heart attacks are one of those things that is going to touch everyone. We know that statistically, it's basically 6 out of 10 folks are going to deal with this issue personally, but we know that almost 100% of people are going to deal with this issue somewhere in their family during their lifetime. So it's one of those things that is good to know. It's good to understand. It's good to be able to recognize before it happens. So, let's kind of jump in and talk about it because, when we think heart attacks, a lot of times, people are thinking, a picture like this. They're thinking this is just something that happens. You never knew that it was coming and, you hope that you survive it. The reality is that's not necessarily the case. These things do happen suddenly. They do happen when you least expect it, but there are warning signs that if you understand them and know them, that you can watch out for. So let's kind of dive into the details. First and foremost, you see this everywhere. The number one killer of Americans is heart disease. Well, or is it? What's interesting is when you actually look at the stats of what's happening right now in our country, and of course I'm talking about the medical stats, because we're going to talk about this in just a second, but when you actually look at, is heart disease really the number one killer, what you'll notice is heart disease has been since 1990 somewhat in the decline, but cancer has been on the rise. Yes, unfortunately, everyone sitting here listening to this presentation right now will see in their lifetime cancer take over heart disease as medically the number one reason or the number one cause of death in this country. Cancer is getting more prevalent. There's a lot of reasons there. You could talk about the food supply. You could talk about the chemicals that are used in our food supply. You could talk about the chemicals that we're exposed to on a regular basis, pesticides, herbicides, all kinds of other things. You could talk about just generally the way that we live our lives and the things that we do and don't do, but cancer is most definitely going to be a big problem in the very near future. But the reality is the number one killer in this country isn't heart disease and it's not cancer. It is our wonderful hand-to-mouth disease. See, what it is our hand finding our mouth way too often with the wrong thing. That then contributes to heart disease, diabetes, cancers, and all kinds of other things. The reality is our inability to stop our hand from bringing to our mouth the wrong things, especially at the wrong times, is what's causing all of the disease and other issues that we're dealing with, and more importantly, the heart attacks and heart issues and heart palpitations and other things that people are dealing with in their families. So let's kind of jump in and actually look at the numbers. This is kind of a telling picture. This is from the CDC. As you can see, heart attack deaths, and this is from 2011 to 2013. I do apologize. This is about 6 years old, but the CDC doesn't necessarily publish on a more regular basis. But when you actually look at the concentration of the heart attack death rates, you kind of see where it's kind of floating around. And what's interesting is most people view Florida as kind of that retirement community. A lot of people from the Northeast move to Florida to get out of the cold and everything else. But you notice is Florida doesn't have a lot of heart attack related deaths. But people in the South and the the mid states are definitely prone to heart attacks at a high rate. So the numbers are somewhat scary. But here's one I want you to look at. The prevalence of diagnosed heart disease among Medicare beneficiaries. So this is Medicare. So now we're talking about, our people that for the most part are our retirees. There are more than that on Medicare, but for the most part you're talking about retirees. And these are people that are dealing with heart disease. So see, the heart attacks and where they're actually dying, that number looked a little bit different than this one. But when you actually look at the people that are being diagnosed with heart disease, you can kind of see from the middle part of the country to the right, going east, not so good. Going west, guess what? They're a lot healthier than we are. at least when it comes to heart disease. So, kind of ask yourself why that is, but the reality is those are, in fact, the numbers. So 1 out of every 3 deaths in the United States is caused by heart disease. 99% of Americans need to improve their heart health. That's right. That's why I said earlier, we're talking to everyone here today, not just some people. We're talking to everyone. Each year, an estimated 785,000 people will have their first heart attack. Let that sit in for a second. 785,000 people will have a heart attack for the first time this year. And then, of course, every 39 seconds, someone dies from heart disease and stroke. It is a massive killer. I mean, we've been in this presentation for about 6 minutes, which means we've had almost 12 Americans die just in the time that I've been talking to you about heart attacks. Now, heart attack is a plumbing problem. Only 27% of people are aware of the major signs and symptoms of a heart attack. Remember when I started out this presentation, I said one of the biggest reasons why people think this is just a sudden onset type issue is because they don't know the warning signs. Obviously, one of the purposes of these lunch and learns is to provide you the information so that you can be informed, but more importantly, you can inform others. Because the reality is, if you are informed, then you know how to at least watch for the warning signs. So what are they? So these are some of the symptoms, some of the things that you should be watching out for. First, you have that localized just under the breastbone or in a large area of the mid-chest or the entire upper chest. You have common combination mid-chest, neck, jaw. You have the left arm and mid-chest areas kind of, hurting at the same time. You have that upper abdomen, we're most often mistaken for indigestion. So if you have a constant case of indigestion that's not being cured by your Pepcid or other antacids, you might want to go get checked out. Of course, you also have the larger area of the chest followed by the right arm. It's usually under the under part of the arm. Any type of neck or jaw or ear type things where it feels like it's tightening, things of that nature. Then you have your shoulder and then the armpit areas, and then of course between the shoulder blades and your back. When you have these types of issues, these tightness, this tingling, these types of things, you probably are best suited by getting to a doctor, getting checked out. We now have all these wonderful little wearable devices and other things that can kind of at least give you an indication. But here's the thing: you'd rather spend the money getting checked out than hoping that you survive the heart attack, because that could be a lot more dangerous than you think. Did you know that Americans have a snacking problem? We're going to jump into some stats and figures now, because these are great contributors to the heart-related issues that we have in this country. You see, if you look at the RDA percentages on the back of any of the food products, they're based upon a 2,000 calorie diet. What this means right here is, on average, Americans are consuming a little over 500 more calories per day than the RDA percentage that it's based upon. That means over a week's time that you're consuming 3,500 calories, or a pound. Think about that. We are eating a pound of calories more per week than we are even supposed to. And that's just the average. Some people are much higher than that. One of the biggest contributors to that is our snacking problem. Men, our snacks are out of control. 586 calories is the average snack for men, 421 for ladies. Eliminating those snacks or making healthier choices could make a big difference in what those numbers look like. We also have a muscle problem, and this is also a major contributor to our heart disease issue, because guess what? All we have is a bunch of fat, especially the visceral fat, around our organs and tissues, including the heart. Men, our average body fat percentage is 28.1%. Healthy is between 10 and 22. Ladies, 40% is the average. Healthy is between 20 and 32. If you are trying to get healthy, if you were trying to, quote unquote, lose weight, and I put that in air quotes because you should never be trying to lose weight. You should be trying to lose fat and gain muscle. There's a difference between those two, and if you don't understand it, we have other lunch and learns that I would highly encourage you to go back and watch. But for everyone on this webinar, the main focus for you should always be your body fat percentage. Lots of ways for you to get this information. One of the easiest is, there are now some pretty sophisticated scales out there that you can actually step on, and they'll give you a pretty good indicator of what your body fat percentage is. Garmin has a great one. that I have personally. And ID Life has a relationship with Garmin. I'd highly recommend that you look into that. But the idea is you really need to focus on your body fat percentage and ignore the weight component, because if you're actually doing your workout regimen the right way, you might actually not be losing weight, but you are losing body fat percentage, which is the true measure of health. The other greatest contributor to our heart disease problem that we have is the fact that 74% of our Americans are overweight. That number is actually going up. It's if you take out the Asian Americans, that number is more like 82% of Americans. When the average Asian American is only 11% of them are overweight, you can understand how they help make the percentages look a lot better. And if you actually jump into the demographic numbers, they get much, much, much worse. But that's a major contributor. So let's look at heart disease by the numbers. This is something that when we do live presentations, I like to go over, because it actually gives people an indicator when it comes to heart attacks to understanding the significance. Okay, so let's start out here. If 10 people stood up in a room, 3 people, or 30% of them, could sit down and never have a heart-related issue in their lifetime. So 3 out of 10 will never have a heart-related issue in their lifetime. Another 3 will have heart disease but will not die from it. They'll die from something else, accidents, cancer, or something else. So they had heart disease, but they did not die from it. That's another 30%, or 3 out of 10. Another 3 out of 10 will have heart disease with a heart attack, get a second chance, but die from it anyway. This is another 30% of people that are going to literally have heart disease, have a heart attack, get notified of what's causing their issue, problems, and other things, and still die from heart disease as a result of the choices that they're making. So that's another 3 out of 10. Well, hold on, that's only 9 out of 10. What about that other one? Well, 1 out of 10 people, the day that they died was the day that they discovered that they had heart disease. So think about that for just a second. I don't know how many people we have on this webinar, but let's just assume we have 100 people right now, and it may be more, but who knows? The reality is this: if we have 100 people, 10 of the people listening to me right now are going to die of a heart attack and never know that they had heart disease. Think about that for a second. That is the Russian roulette game that we're playing with our heart. It's kind of the central focus of everything that happens inside our body. It is something that we should actually pay attention to. Most importantly, it is something that we should take care of. Men, I'm really talking to you here more than anything else, because guess what? We're the ones that are too macho to go to the doctor and get our annual physical. It's one of those things we have to get checked out. We have to make sure we're doing what's necessary to take care of ourselves. Ladies, you die of heart disease more often than men. You need to make sure that you're taking care of yourself so that you can take care of the people that you love and care about. So let's actually get into the facts and figures, because I like to give the demographic numbers and other numbers here so that people can understand the significance of the problem. Because if you understand the significance of the problem, maybe you will act proactively rather than reactively, because as we just found out, 1 out of 10 people listening to this webinar, if you follow the reactive approach, you never got a chance to react because you died before you had a chance. So 1 out of every 3 deaths is related to heart disease. We heard that earlier. Okay, we know that fact. 1 out of every 3 deaths is related to heart disease. Obviously, something needs to change. Every 28 seconds, someone has a heart attack. Let that set in for a second. We're now 14 and a half minutes into this. We've had 30 people have heart attacks in the U.S. since we started this presentation. 30. And we're only 14 and a half minutes in. The number's growing the more that I talk. And the good news is I don't have a lot to talk about, but this is still happening all the time. That's over 1 million heart attacks per year in the U.S. That's just the U.S. That's not the world. But we have a major issue in this country. Or over 3,000 heart attacks per day, 40% are fatal. Remember, it's 1 out of 10, the first heart attack is going to be fatal. But when you actually add up all the heart attacks that are happening, of the 30% per day, or 3,000 per day, you have 40% are fatal. That's 1,200 people that die every single day in this country of a heart attack. Every 33 seconds, someone dies from heart disease. Not necessarily a heart attack, but this is usually referred to as congestive heart failure. That number comes to 2,600 people per day are dying. So you have 1,200 people that are dying of a heart attack. You have 2,600 people a day dying of heart disease. That's over 955,000 heart disease deaths per year. And of course, the National Institute of Health contributes 500,000 heart disease deaths per year to a poor diet. Think about that for a second. We have 500,000 people that are dying every single year in this country of heart disease related to the fact that they had a hand-to-mouth problem. You know, last week we talked about, or yeah, I guess it was last week, we talked about cravings and the addiction to food, and especially these processed foods and the way that they're made with their bliss points and other things. There's a direct correlation between those types of foods, those types of cravings, those types of addictions, and the health epidemic that we have in this country, where we are literally eating ourselves to death. You know, it's the stuff that we are actually doing to ourselves that's doing this to us. These things are avoidable. Currently, there are over 27 million cases of obesity-induced heart disease in the United States. Think about that for just half a second. 27 million people in this country have eaten themselves into heart disease. The good news is this is reversible. This is something that can be changed. If this is you, if you're suffering with this issue, don't feel like, I'm just going to enjoy my time on earth. That is the thing that drives me the battiest. I mean, I have a personal just cringe every time I hear somebody say that. Well, I'm going to enjoy my time. Well, the reality is this. That's a very selfish statement, because I promise you there is somebody out there that relies on you, that cares about you, that loves you, that wants to spend more time with you, and would love nothing more than to have a few extra years, months, or days with you that would have been preventable had we chosen something different as with regard to what we're going to eat. You know, I lost one of the most dearest people in my life, my grandmother, to heart disease. She actually had 3 heart attacks. You know, she beat all the odds. She actually had 3 of them and then died of congestive heart failure later on in life. She was 77. But I would have loved to have her see my grandkids. Her grandchildren. I would love to have her around just a little bit longer to see some of my life's events and things that I did. But the reality is her choices and her diet contributed to her life expectancy. And that's unfortunate. Heart disease costs the United States economy $108.9 billion per year. Yeah, that should be shocking to you right about now. You know, it's one of those things when you actually sit back and think about all these stats and all these figures, and you look at the cost of heart disease. This is something that this should be your reaction right now. You should literally be just completely mortified. And I guarantee you, if you're listening to this webinar, you know somebody who needs to listen to this, because this is today's wake-up call. But now we're going to jump into the demographic numbers, because when you actually look at those, it is really a very, very bad situation out there. So let's jump in. Women. I'm talking to all the moms and the grandmothers and all of those out in the world. Heart disease is the #1 killer of women, more than all cancers, respiratory diseases, and Alzheimer's disease combined. 90% of women have at least one risk factor of heart disease. That's right, 90% of the women listening to this webinar right now have one risk factor. What are you doing about it? 64% of women who die from heart disease had no prior symptoms. Now, remember what I just said. 1 out of 10 heart attacks is fatal. First heart attacks are fatal, okay? But 64% of women who die of heart disease had no prior symptoms of heart disease before it happened. Ladies, get checked out. Do what you got to do to take care of yourself. I know that, if you're like the ladies in my life, you spend all your time trying to take care of others, and, whatever time's left, you try to take care of yourself. Make yourself a priority. Make sure that you're taken care of so that you have the ability to take care of the people that you care about and love. 1 in 4 will die within 1 year of their first heart attack. Now, what's the reason for that? Why do 25% of people die within 1 year of their first heart attack? Because they don't make changes after they get the opportunity to. They continue to eat and choose lifestyle that they had before the heart attack. Make the changes necessary. And of course, a woman dies every minute of heart disease in this country. We're 20 minutes in, that means 20 women have died since we started this. African Americans are 2 times more likely to die from heart disease than white Americans. 49% of African American women and 44% of men suffer daily with heart-related issues, compared to 32% of white women and 37% of men. African American women and men suffer the highest prevalence of high blood pressure in the world. African Americans are 77% more likely to be diagnosed with diabetes than white Americans. And obesity rates have a lot to do with the disparity, because 80% of African American women and 78% of Hispanic American women and 60% of white American women are overweight. Wanted to make sure I gave everyone those stats, because this is an alarming demographic difference that we should be talking about on a regular basis so that people can understand what's actually happening in this country. When you actually look at the numbers, black men are at the highest risk of dying early from heart disease and stroke. In fact, when you actually look at the people that die, what you see is the prevalence or the preventable deaths per 100,000 people. These are preventable. Okay, so these are people that literally ate themselves or chose a lifestyle that ended up killing them because of heart disease. That's something that they could have changed. And when you actually look at the demographic information, you can kind of see the numbers are way out of proportion. Hispanic Americans. Well, let's look at the numbers here. 1 in 3 have heart disease. Causes more deaths than all cancers combined. 66% more likely to be diagnosed with diabetes than white Americans. And Hispanic Americans aged 20 and older, 75%. Well, let's back that up. Before we get to the Asian Americans, let's back that up. 1 in 3 have heart disease. Causes more deaths than all cancers combined. We talked about that. 66% more likely to be diagnosed with diabetes than white Americans. Hispanic Americans aged 20 and older, 75% of men and 78% of women are overweight. Think about that. Age 20, 75% of men and 78% of women are overweight. And Hispanic women develop heart disease 10 years earlier than white counterparts. A lot of this is cultural. A lot of this is diet, lifestyle related. We need to make a change here. But most importantly, we need to have the information. We need to understand this is happening. See, what happens to us a lot of time is we look at national averages and we don't look at our own demographic information. You know, we're all uniquely designed. We all have a very specific genetic sequence and genetic code that is tied directly to our heritage and where we came from and our ancestry. The main component of what we need to be focused on is not the world, not necessarily the entire population. We need to be looking more specifically on our individually particular needs. And when we actually dig into the numbers, what you find out is we have a real problem here in the Hispanic community and the African American community that needs to be addressed. And I'm hoping that at least these webinars at least give you the information to start that conversation. With regard to Asian Americans, well, only 7% have heart disease. It's interesting to me. I've always questioned, people always talk about how bad carbohydrates are, but if you actually look at the typical Asian American diet, it's about 50% carbs. If carbs were all that bad, then why is only 7% have heart disease? Causes more death than all cancers combined. 11% are overweight or obese. Remember, I told you that earlier. And 18% more likely to be diagnosed with diabetes than white Americans. There's when the carbohydrates come in, because there is a lot of sugar, or at least conversion of sugar in the body there. A lot of that's contributed, rice, noodles, what we would call simple carbohydrates. So, these are the numbers by demographic. These are the numbers that we're dealing with. Then we get into another area that is alarming, and that's young athletes. We've heard lots of stories in the news that happen at least, 4, 5, 6 times a year, where some local kid is playing on a basketball court, on a football field, on a baseball field, or a hockey rink or something, and suddenly just keels over and dies of an undiagnosed heart-related issue. In fact, here in Texas, part of the annual physical for high school athletes now involves some type of heart-related test to try to figure this out. It's what we refer to as sudden cardiac arrest, and it is the leading cause of death in young athletes. And of course, it occurs in young athletes every 3 days. See, earlier I said you hear about every 5 or 6, 5 or 6 a year, but the reality is this is happening every 3 days in this country. Think about that for a second. Every 3 days we are losing a young athlete due to sudden cardiac death. 90% of these athlete deaths are male. So if you have a young son, make sure you're getting him checked out. Have this checked for specifically. More than 52% of these deaths are African American, and the average age when it occurs is 17 and a half. This is our future, folks. These are our children. We need to make sure we're doing what we need to do to take care of them. So, we've gone down the depression road. We've given you all of that wonderful information. Let's talk about the medical protocol treatment for heart disease, shall we? Because this is how a lot of people think. Especially people like my mother, who has congestive heart failure, has actually had open heart surgery, had bypass surgery, and all the rest. Yes, sometimes you can preach from the mountaintops, but the people closest to you don't think you know a thing about what it is you're talking about. My mother is one of those. My kids are another sometimes, but they're starting to come around. But let's look at the medical protocol, because to me, it's kind of alarming. Option A is this. This is the typical cardiac management protocol. Starts with cardiac rehab, then you try to encourage a lifestyle change, and then you go to prescriptions, and then you have some type of implanted device, and then you have surgery, and then you have death. That's option A. And what option A is, in essence, is a management program. It's an extension of life program. There is no cure, just so you know. If you start down the medical management approach to heart disease, there is no cure. All it's going to do is an extension of life. That's all it's designed to do. And you need to know that. It has a 0% cure rate. Option B is a little bit different. See, when you actually jump into the information and start looking at all of the details, there is another option. There is something else that you can do if you are suffering with heart disease, or you're worried about developing it, or in fact you want to reverse it. Starts with Dr. Dean Ornish, who did some studies that I want to kind of show to you. Dr. Ornish, his initial study involved 2 groups of heart disease patients. The control group received the customary standard care prescribed, a diet centered on lean meat, poultry, and fish, along with various medications, and the usual advice not to smoke. So this is kind of the, eat less, move more, eat better things, and don't smoke, and you'll be fine. The test group was prescribed a low-fat vegetarian diet, brisk walking for a half hour per day, or an hour 3 times per week, no smoking, and stress management exercises. So key here, a vegetarian diet. I want to make sure I emphasize that, because that becomes key. What did he find? Well, the control group got worse after 1 year. In addition, the test group had a much different outcome. Chest pain disappeared within weeks. Think about that, within weeks. Vegetarian diet, chest pains disappeared within weeks. Cholesterol levels dropped dramatically. Coronary arteries, which had gradually been closing off, actually started to reopen. It reversed coronary artery blockage. An angiogram showed clear evidence of reopening in 80% of patients. There was something else that happened. The major side effect from the test group, not the control group, not the one that was following the typical medical protocol, but the control group, the one that was doing the vegetarian diet and actually walking, no big physical exercise and things like that, just walking, they lost 22 pounds in the first year. Think about that. All they did is they said, okay, fine, we're going to go to a vegetarian diet and we're going to actually start to walk or exercise. Actually move is really the best definition of that. They reversed their heart disease. They started to unclog their arteries, and they lost 22 pounds in a year. And some of you are sitting there like right now thinking, oh man, I just cannot give up my meat. And most importantly, I cannot give up my pick whichever bag, box, jar, or can is your favorite. And that's what you're talking about right now. And what you're going to find out is that's why we have 500,000 deaths a year that were preventable, but are actually occurring because of heart disease related to the diet that we chose. A great book for somebody if you know that they have had heart disease is this one right here. In fact, if I know you and you're near and dear to me, and you have any type of heart disease or heart-related issue, you get this book from me. I buy it myself, I send it to you, and I hope and pray that you actually pay attention to it. It's a book by Dr. Greger, How Not to Die. There's over 30,000 independent studies that have been done on what he is talking about in this book. And what you find is there is only one thing that has ever been proven to reverse heart disease. Well, let that sit in. To reverse heart disease, completely reverse heart disease. One thing, and it has nothing to do with a pill, potion, lotion, or surgery. It is a vegetarian diet. It's actually going to a plant-based diet. This book goes through all of the details. It's an easy read. It is thick because he does go through all the scientific studies and everything. But when you actually look at the numbers, this is plant food consumption versus the leading killer diseases, specifically what you're talking about is heart disease and cancers. There seems to be a direct correlation between the percentage of plant foods in the diet versus the amount of heart disease and cancer deaths. See, in the U.S., only 14% of our diet comes from plants. 78% of our deaths come from heart disease and cancer. If you go over to Laos on the far right-hand side, what you find is only 5% of their deaths are from heart disease and cancer. A lot of that's because 92% of their diet comes from plants. And when you actually start looking at the numbers, it wasn't too long ago that Mexico had taken over the U.S. as the fattest population in the world, and the U.S. wasn't going to have that, so we took it back the following year. But even then, when you actually look at the numbers, what you find is only 25% of their people actually die of heart disease and cancer. A lot of that's because 48% of their diet is coming from plant foods. So something to keep in the back of your mind. If you know somebody with heart disease, or if you are somebody with heart disease, one of the surest, fastest, commonest ways, and only scientific proven way to reverse it is to actually go to a plant-based diet. When we do these lunch and learns, they're all about giving you information that you can put into action, information that you might not have otherwise known, information that you can use to better yourself and better the people that you care about. And that's what these things are about. We call it Life Simplified because the whole concept behind why we do these is to help you simplify the decisions that you're making on a daily basis so that you can get the results that you've always dreamed about. Or better yet, understand that the small choices that you're making on a daily basis contribute over a period of time to the diseases, issues, and problems that you may be suffering with today. If you've decided to make a change, understand you didn't get to where you are in a day, and you're not going to get to where you want to go in a day either. It's going to take some time. These are not easy changes. That's why we talked last week about cravings and how you're having to fight your brain. It's not about always winning the battle, but it is about winning the war. And with the information, at least you have a chance of doing that.